Now that you've made a decision to go ahead with an ablation for your atrial fibrillation, I thought it would be important for us to review with you what you can expect before your ablation procedure, as well as afterwards. It's very important that you stop your antiarrhythmic medications before the procedure so that they do not interfere with the results of the ablation. Many of you will also be on an anticoagulant. You'll find that some centers will continue those, especially Coumadin, but we found in our own research that it's safer for you to undergo the procedure without that being the case. We also will start people on an antacid. It's been shown that by using acid reflux blockers, we can cut down on the potential for damage to the esophagus. We've used this routinely, and in well over 2,000 ablation procedures, we have yet to have any complication involving the esophagus. People always ask as well, what if I have other procedures that I need to carry out? What if I need to have dental work? What if I need to have another surgical procedure? Well, in general, it's probably best to try to carry that out before you have your ablation procedure. If your other physicians and we deem that it's safe for you to do that while you still have atrial fibrillation. After the procedure, you will be on an anticoagulant, so that's something that needs to be taken into consideration after the procedure. We would not want you to schedule surgery a week after the procedure for your atrial fibrillation at a time when you're then on a blood thinner. The morning after the procedure, and we will keep you overnight in the hospital, you will be sent home with a monitor. We like to use a trans-telephonic monitor so that we can keep track of your arrhythmias after you've been discharged from the hospital. We usually do this for a month, but sometimes more. You will be on an anticoagulant even if you have not been beforehand. Our nurses will be able to coordinate with you when to stop your medications, as well as arrange for you to have prescriptions for any medications that you do not have ahead of time. People always wonder, when can they get back to their regular activities after having an ablation procedure? We will allow you, and in fact ask you, to get up and walk around and carry out light activities as soon as possible. In terms of regular exercise and heavier exercise, we'd ask that you refrain from that for a few days, simply to allow the groin to heal up. From the standpoint of your heart should be fine, and we would not restrict you from that aspect of your activities. When you are discharged home from the hospital, you actually may have some symptoms that are related to the ablation itself. We sometimes find that people have a sense of discomfort within their chest. Realize that we've done a lot of ablation and irritation of the heart, of the atrium, during the course of your procedure. That irritation, which can also sometimes lead to some transient arrhythmias, may give you a sense of discomfort in the chest. This is not very severe, and this always subsides, but we want to just let you be aware of the fact that that's a possibility. It's very important for you to understand that even if you have some arrhythmias early after the procedure, that does not necessarily mean that you're not cured. We will not decide whether or not your ablation has been successful for at least 3 months after the procedure. We've also seen people that at the same time, for the same reason, may have a low-grade temperature shortly after the procedure. That too is something not to be too concerned about and should resolve very shortly. It's been incredibly rare for people to have any sensation of a discomfort that lasts more than a day or two. At about 3 months after the procedure, you will come back into our office. We've expected at that time, if you're local, we may have seen you, but many of you have come from quite a distance to see us for your procedure, and we would expect that you followed up with your local physician, your local cardiologist during that period of time. At that 3-month point, we will decide whether or not you are in fact cured. If you are, that doesn't mean you'll stop having any contact with us. As you've heard from Dr. Winkle, we want to continue to follow your progress and your course over time so that we know the long-term outcomes of our ablation procedures. So even if we don't see you back for a regular follow-up, you will be in contact with our nurses or some of our staff who will ask how you are doing, if you've had any recurrences of your fibrillation, if any other medical issues have occurred, and that way we can keep track of what happens long-term to you, as well as all of the other people who have undergone the ablation procedure, which will allow us to then continue to hone and perfect this procedure to cure people like yourself. Our primary goal is to, in the safest, efficacious, and successful way possible, to carry that out for you.